proposed regulations for women's healthcare centers. I'd like to remind the board that the Attorney General is charged by law with the responsibility to review proposed regulations and to opine on the legal authority of the board to issue them. The law does not, however, give the Attorney General's office veto power over your decisions regarding what to include in final rules. The Attorney General's office has given you and the Department of Health advice. The office's advice should inform the board's action, but it cannot and should not decide it. The board's statutory authority to regulate comes from Virginia Code 32.1-127A, which provides for the promulgation of regulations for healthcare facilities in substantial conformity to the standards of health, hygiene, sanitation, construction, and safety as established and recognized by medical and health professionals and by specialists in matters of public health and safety. These proposed permanent regulations do not meet that standard. Courts in Virginia have been clear that the authority allowing an agency to promulgate regulations also obliges the agency to only adopt rules that are actually consistent with that statute's purpose. Although the Department of Health and Attorney General's office has stated that the medically unnecessary and burdensome architectural requirement is mandated both by the enabling statute, Senate Bill 924, and other Virginia code, this assertion is mistaken. In fact, neither statute mandates that existing facilities meet the Facilities Guidelines Institute standards, and clearly no other type of facility in the state has been forced to rebuild its existing buildings as a result of existing Virginia code. We are aware of no other instance in which Virginia has required existing healthcare facilities to comply with regulations or guidelines designed for new construction.
Thank you very much.
President Rooney and Dr. Ike Roosevelt.
Hi, my name is Jules Rooney. I am an intern with the ACLU Women's Rights Project. The regulations dealing with on-site inspection permit the Department of Health employees to arrive on premises at any time and requires the facility to give them access to the facility and to patient medical records and patient lists without appropriate protection for patient confidentiality. The temporary regulations included a requirement that the abortion facility provide a surveyor with a list of current patients. This provision unnecessarily infringes on the confidentiality of the patients seeking medical care at the time that an inspector chooses to arrive on the premises. Despite receiving comments on the draft regulations encouraging VDA to strengthen the confidentiality protections, VDA chose to make the permanent regulations substantially worse by requiring a list of all patients for the previous 12 months, as well as a list of patients receiving services on the day of the survey to be provided to the surveyor. Also, several different sections of the draft from permanent regulations give VDAs the right to request all ownership information in many types of facility policies and procedures, such as facility security and disaster preparedness plans, without any requirement that these documents be kept confidential. Adding a new provision requiring the names of patients for the past 12 months is not a mere clarification of the term current patients, but rather an unprecedented intrusion on patient survey privacy. VDH and the Attorney General Office cites to Section 32.1-25 of the Code of Virginia, part of the hospital code, in their response to requests for increased patient and provider protections. The department has already said it sees no need to enforce more than a handful of statutes in the hospital code, and the code sections they mentioned do not include Section 32.1-25. Despite the statement by VDH and the Attorney General's Office that their staff are bound by confidentiality laws and agency policy, a unique audience exists whose sole purpose is to collect information about abortion providers and their patients. It's in the best interest of VDH to protect this information from any possible potential disclosure.
Thank you very much.
Next will be Dr. Cosio and Dr. Kenneth Oshansky will be on deck.
Good morning, ladies and gentlemen, Dr. Emily and board members. Thanks for the education about what happens at the Board of Health, at the Virginia Department of Health. It's not only letters that I get from you on the internet, but it's a lot more in depth. I'm a licensed physician in the state of Virginia for 34 years of practicing urology. I have been doing procedures in my office that are often much more complicated than abortions. I have never been restricted in any way by regulations that are being promulgated here today. Dr. Lake mentioned, Mr. Lake mentioned issues related to quality improvement and evidence-based decision-making. And the evidence in this case is that, in this situation, is that abortions have been safe. They have been looked at over and over again, and there's no evidence that there's been any harm to the general public. Complications occur in all medical specialties. We have ophthalmologists, dermatologists, and certainly plastic surgeons doing procedures in their office that are far, far more complicated and have never been subjected to these targeted regulations. So the question I have is, why is it happening with women's reproductive health? We all know what's going on. It's political forces that are dictating medical care. This is a very dangerous, slippery slope, because it could happen to other specialties depending upon the political winds or the political winds going on. I just ask of all of the medical professionals and lay members of the board that you look into your medical conscience and your lay conscience and do the right thing and reject these regulations. Thank you. Thank you, God.
Dr. Kenneth Olshansky and Shelley Abrams will be up next.
Thank you very much. I'm a physician, and actually I'm glad I was able to be here at the beginning of the meeting. First of all, I was very impressed when Dr. Lemley showed the vaccine projects, and all of those were responding to medical data and medical needs. There was no politics involved, and I compliment you on that. And again, when Mr. Lake said the board is going to be rated on how it uses evidence-based medicine, I think that is what this is all about. This, in all honesty, is not about abortion. This is about the integrity of a process. And as a physician, and I know all of the physicians on this board will agree, that when decisions are made that affect people's health, they need to be based on good data. So all I ask is any decisions made, and I don't envy you, this has become a terribly political circus, and it shouldn't be. But all I ask of this board is when any decisions are made, please, on your decision, put down what that decision was based on, what evidence you had, and this will maintain the credibility of this board. If it's being based on political reasons, then this board loses all of its credibility. So whatever way you vote, make sure that it's really based on what all of us know are good data, so the future of this board is not impugned. And I thank you and don't envy you.
Shelley Abrams and then Stephen H. Benheim? Is that right?
Hi, my name is Shelley Abrams. I'm the manager of a local area abortion provider. I'm standing here before you today for the third time since all this began last year. In my previous talks, I discussed how safe the medicine we practice is, and I told you some of my patients' stories. I realize now that it was a waste of my breath and all of our times. In the beginning, I thought this board actually existed to do good, to help the people of Virginia and make fair, medically sound decisions. Since I last spoke in December, I found out that Gail Taylor here donates money to the anti-abortion group, the Family Foundation. I found out that yesterday she held a fundraiser for Ken Cuccinelli, who has openly stated he wishes to rid the Commonwealth of abortion access. I would ask her to recuse herself, but that would imply that I think this is a proper process and that the members of this board are working from an ethical and not political standpoint. Speaking of Ken Cuccinelli, I found out that his office removed a grandfather clause from the originally recommended draft of the regulations. The Virginia Department of Health works for Governor McDonnell and Ken Cuccinelli, so they have to do what they're told. The grandfather clause would have saved many clinics from having to shut down, which is the only rational explanation for why Mr. Cuccinelli wanted it removed. I found out that Ms. Amy Best here, also a member of the board, has a moral objection to dispensing emergency oral contraception, which she considers, quote, equivalent to abortion, unquote. She has spoken publicly about this and supports the so-called conscience clause. Again, I would ask her to recuse herself from these proceedings, as she is clearly and outspokenly anti-abortion, but I would probably be wasting my breath again. Most of the speakers today will talk to you about safety. I simply wanted to speak on the board's level and talk to you about politics. As far as politics goes, you guys are doing a great job. As far as safety goes, I'm sure your political appointments are safe. Thank you.
We have Steve Bentheim and then Holly Puritz to follow.
Chris Chisholm followed me, then Molly Stewart.
I was going to say, then for a moment of clarification, I think your names are written down twice on this sheet. So what you'd like to do, I think, is Steve Bentheim, then Chris Chisholm, and then Holly Puritz, correct?
Thank you, Karen. Thank you for allowing me to speak. My name is Stephen Bentheim. I'm a local OBGYN and currently the chair for ACOG for Virginia. Chris Chisholm and Holly Puritz behind me also represent ACOG. Holly is the vice chair, Chris is the secretary treasurer. I'd like to say that ACOG is neither pro-abortion or anti-abortion. We consider ensuring the safety of women in Virginia as our primary mission. We have previously worked peripherally to have input into the regulations that are now being considered, and we now feel compelled to speak publicly. As long as abortion is a legal option for the women of Virginia, we strongly believe it should be safe, accessible, and affordable for all. If it's okay, I'll let Chris Chisholm speak now and discuss some of our specific recommendations.
Regarding the proposed regulations, we have three areas of key focus. One, regarding the emergency transfer agreement, we believe this to be unnecessary and burdensome. The nearest hospital emergency room to any outpatient facility must provide a medical screening exam and any needed treatment under EMPOWER. If a hospital were to refuse to enter an emergency services agreement, a clinic would be forced to either obtain emergency services agreement with a hospital further away, potentially delaying the care for a woman, or to close. We offer the following provision as a consideration as an alternative. When emergency transfer is necessary, the responsible physician of the abortion clinic must provide direct communication to the emergency department staff regarding the status of the patient and the suspected complication. Number two, regarding the confidentiality of staff and patients at the time of inspections. We recognize and respect that Virginia Department of Health inspectors are governed by confidentiality agreements. We encourage the board to consider additional safeguards to protect the confidentiality of staff and patients, given the sensitive nature of reproductive health care. Lastly, regarding the architectural standards, we believe this is a burdensome requirement for facilities providing a safe, low-risk procedure, which may have the unintended effect of limiting access by forcing closures of clinics. Clinics currently in operation should not be required to retrofit their facilities to meet the standards of new construction unless they choose to do so voluntarily. We refer the board to the South Carolina regulations, Section 807, and particularly subsections H, I, and K to provide guidance regarding the architectural standards. Thank you.
As elected representatives of ACOG, we represent all of the OBGYN physicians in this Commonwealth. Our colleagues are on both sides of the issue, and reasonable people can disagree. However, at this time, in this Commonwealth, abortions are both a legal procedure and a safe procedure. As physicians who have dedicated ourselves to care for the lives of the women in our communities, our goal is very simple. We want to assure safe and accessible health care for the women of Virginia. As you consider permanent regulations governing abortion facilities, we strongly encourage the Board of Health to carefully consider the issues of access and cost. As we previously outlined, we feel the current regulations are so restrictive that they will negatively impact both access to care. We sincerely hope that you will reconsider these regulations and allow healthcare decisions to remain where we feel they should be, confidential and between the physician and their patient without burdensome regulations. We respectfully offer our expertise and time, both from ourselves and members of ACOG, to assist the board in reaching final regulations that are evidence-based and that assure patient safety and preserve access. We do not feel that these current regulations as written do that, and we respectfully ask that you reconsider it as written. We thank you for your consideration.
We've now got Jill Abbey with Frida Gephardt next after she.
My name is Jill Abbey. I'm the director of the Richmond Medical Center for Women. I've been working in women's health care since 1983 and at the center since 1991. We've been providing reproductive health care in our offices across the state since 1973. Dr. Pitchie, our physician, is a well-respected professional and well-known in this field. Physicians across the state refer their patients to him. Abortion is a safe, legal medical practice. At least half of women will experience an unintended pregnancy, and 1 in 3 will have an abortion in the U.S. by the age of 45. It is critical that the permanent regulations permit the continued availability of safe, legal abortions in multiple locations across the state. Early abortion is already difficult to access, with 86% of counties lacking an abortion provider. I'm deeply concerned about the effect that the proposed regulations will have on the patients who seek care from us, particularly Section 370 of the Design and Construction Regulation, which other people have already spoken to. The Department of Health appointed an expert panel of 6 doctors to collaborate on emergency regulations, among them Dr. James Ferguson, chairman of OBGYN at UVA Hospital. He stated that they developed a product based on our expert opinions, based on a review of different groups such as ACOG, folks that are pretty knowledgeable and well established in that area of care. The regulations they proposed were plain good medicine in terms of good care for patients. When the regulations came back from Mr. Cuccinelli's office, they were more restrictive and included different requirements that would unmeter the clinics providing first trimester abortions. He called them a solution looking for a problem. These regulations will limit access to safe abortions by driving legitimate providers out of practice at a time when women need more access to care, and we ask you please put women first.
Thank you very much.
Frida Gephardt and then Margot French.
Thank you. My name is Frida Gephardt. I'm from Roanoke, Virginia. And I had the pleasure of serving on the State Advisory Board for midwifery under the Department of Health Professions. And when I received that appointment, I took very seriously the oath that I had to take, that I'm sure that all of you had to uphold the Constitution of Virginia and its principles. Part of my background was a social studies teacher. And one of the things that some of you might not be aware of, so Thomas Jefferson wrote Our Separation of Church and State. It is the strongest in the nation. They watered it down for our U.S. Constitution. Virginia has the strongest separation of church and state. That means that you are welcome to your religious viewpoints. But when you sit and represent the people of Virginia, you must do so according to evidence-based good policy, good public policy. And when you sit on the Department of Health Professions, you do so in the protection of the health and welfare of the citizens of Virginia. The people who spoke prior to me talked about how this current regulations that have been asked for you to pass is detrimental to the health and well-being of the citizens of Virginia. The citizens of Virginia are being represented by the people in this audience, and the eyes of the nation are upon us as we make this decision today. I ask for you to abide by your oath to support the Constitution of Virginia when you make your decision today. And for those in the audience who support what I'm asking the board to do, if you would please stand and show of support, since you may not be able to speak today. Thank you very much. Thank you for your time.
Margot French and then Caroline. I think it's 2 votes.
Good morning. My name is Margot French. I'm from Fairfax, and I thank you for this opportunity to address the Virginia Board of Health. I didn't think I'd be addressing the board, so forgive my rather casual attire. In performance of your duties as Virginia Board of Health members, I would ask you, in making this consideration on regulations that would impact clinics, do not base your decisions solely on personal or political ideological concerns, but after consideration or an assessment on possible and potential impacts that there may be on programs such as Plan First, which I just learned about this morning. I was not aware that Virginia had this program. But what impact that a decision this board makes could have on Plan First or on the Commonwealth's Medicaid costs, as women below the poverty level lose access to women's health or reproductive counseling and or support if clinics are forced to close due to the recommendations, your decisions of this board. Thank you very much.
Carolyn Hoover, and then Kelly, and I apologize, who's that? Kelly, you will ask.
I don't have anything fancy prepared to say. This is kind of the last one. All right. I don't have anything fancy to say. This is kind of the last one. This is the first time I've ever come in front of you before to express my viewpoint and to basically assert my rights. From what I understand, the country was founded based upon freedom from religious persecution. And I've just been hearing people talking about whether or not the basis goes back to what America really stood for. Not a lot of people talk about how our country has kind of gone downhill. And I think a good way to get back to what America really stands for is to kind of look at our beginnings and look at, say, for instance, when you look at America's beginnings, you look at the Pilgrims. The Pilgrims came here seeking freedom from religious persecution. This legislation that's about to be considered, I really see no basis for it whatsoever. It basically unfairly puts restrictions on abortion clinics, which is a type of outpatient clinic, as a doctor mentioned earlier, so it's getting plastic surgery done. But these impositions aren't being placed on places that do plastic surgery. I just think we need to look at the reasons why we're going to be considering something like this and see that these reasons are not at all based in science or reason, but based on personal opinions and politics. And quite frankly, politics and personal opinions, at least the personal opinions of the people who are not making choices about their own bodies, really shouldn't be considered. It's my choice, my body. Thank you.
Thank you.
Hi, I'm Vicki Ryan, and last time I was here was in December. So I'm going to real quick review some of the facts that I told you all several months ago. For example, Dr. James Ferguson II won't put his name by the regulations that you all will soon pass or not pass. Dr. Jerome Strauss III from VCU, again, will not put his names by the regulations that you all will or will not pass today. Two of the top medical experts you all asked to provide guidance won't put their names by the regulations, and that's a problem. Now, I could continue with what I said back in December, but I think we're all tired of that, so I'm going to continue. I felt like you guys weren't impressed with me because I was just a VCU social work student. So I went out and got a job as a receptionist in an abortion clinic right here in Richmond. And this is what I've learned. I'm going to walk you through the process, because I know most of you don't actually know what an abortion clinic's like here in Virginia. Let's say I'm one of the 13.2% of Virginians that don't have health insurance, or 889,000. Say I'm one of them, okay? Let's say I don't have health insurance, and let's say that means I can't go to the doctor and I can't get a birth control prescription. So you're telling me you want me to rely on the man to slide a condom on his penis while we have sex to make sure that I don't get pregnant. You're not going to put that in my control because I don't have health insurance. I can't go to a public health or a women's health clinic that could provide me contraception. You're telling me that you'd rather me trust the man to put the condom on and not for the condom to break. I'm saying that's sexist and we need to get over it. How is it helpful to leave women at the mercy of a man? It's so helpful that we passed Roe v. Wade back in the 1970s, and we were in a very conservative climate. So I hope that you grandfather in pre-existing clinics for the architectural requirements. Thank you.
Martha Doyle, and then next will be Dr. Wendy Clark. Martha Doyle, and next will be Dr. Wendy Clark.
Okay, my name is Martha Doyle. Thank you. I am a nurse and a surgical coordinator at Falls Church Healthcare, and every day when I go to work, I'm helping women from all walks of life. During my day, I do sonos, transvaginal sonos, which you guys passed, thank you. I speak to patients about birth control, preventing pregnancy, and assisting the doctor with abortions every single day. The horrible regulations that you may pass are both being imposed on our safe clinic every day. They're against women. You guys are very against women. Thank you. The women and families that come into our clinic come in because we do not judge them. We treat them with compassion, love, and understanding. Our patients do not care how big our janitor's closet is and how wide our hallways are. The women just care that they can come in to get a legal abortion. If we pass these regulations, women will result in doing home or back alley abortions by an unqualified provider that will lead to infections, scarring, death, or being unable to get pregnant again when they choose. If this happens, women will crowd the ERs because people do not have insurance in Virginia. If you close all of the clinics, patients will not have access to sonos, birth controls, STD info, pap smears, and gynecological care. The reason I'm here is to ask you to not pass the regulations. Keep all safe clinics open so that the women of Virginia can have legal abortions and not go back in time. Thank you.
Ms. Doyle, just for clarification, I'm going to ask this for a number of you. It looks like your name's in 3 different places.
I only signed on page 2.
Yeah, on page 1, that was Martha, so there is no Martha Doyle.
No, it's Marsha, M-A-R-S-H-A.
Hi, good morning. As a physician who has cared for women for 25 years, I am deeply committed to excellence in patient care and to the highest standards of patient safety. In fact, I have no doubt whatsoever that every healthcare provider in this room feels the same way. However, it is crystal clear that the proposed regulations before us pretend to be about safety when there is no safety issue. It is clearly established that abortions performed under 12 weeks have an outstanding safety record in the state of Virginia, and there has not been one iota of evidence to the contrary. It is reprehensible to mislead citizens of Virginia into thinking that these regulations improve safety, when what they are in fact designed to do is to limit access and close clinics. To mislead people into thinking otherwise is simply that, misleading. For clarification, other dictionary words for mislead are misrepresent, scam, misinform, misguide, and distort. It is appalling, in my opinion, that this administration has hijacked the work of the health professionals who were appointed to promote and protect the health and welfare of patients in the Commonwealth, and has blatantly ignored the expertise of an esteemed medical panel comprised of leading women's health experts in Virginia, and please note, a panel that was comprised of both anti-choice and pro-choice physicians. These regulations dishonor the core mission of the Board of Health, which, as defined in the Code of Virginia, is to improve access to care. How can a board do that when politics has so clearly trumped science, medical expertise, and the best interests of the women of the Commonwealth? Please do not deny us our praise. Thank you.
Somebody has written down a number of people's names for the people that write down their names, so we'll have to kind of make sure that we don't have duplicates over.
Good morning. My name is Meredith Johnson-Hallmark. I'm an assistant professor of law in the District of School of Law, family law, children in the law, and of course public related interaction. I'm going to speak to you all today very briefly about my 3 primary concerns with these proposed amendment regulations. And they are legal, practical, and equitable. The first concern, as a lawyer and law professor, I have serious legal concerns about these proposed regulations. First of all, the irregularities in the rulemaking process itself, and then the content of these permanent regulations raise serious concerns under Virginia administrative law. Second, the fact that these regulations single out reproductive health clinics and women seeking reproductive health services for different treatment from other similarly situated outpatient healthcare providers raises serious concerns about equal protection of the law under the Constitution. And finally, the increases in the price that are sure to result from these regulations, the threatened closures of some reproductive health care providers, erect substantial barriers to women's access to abortion services and related services, and these raise serious constitutional questions about an undue burden is unconstitutional under Supreme Court precedent. Those are my legal concerns. Practical concerns. I think these regulations are going to have perverse and unintended consequences. First of all, experience teaches us that these sorts of regulations will not deter women from getting abortions. It will only delay their receiving abortions. What does that do? That increases the health risks for the women receiving later term abortions and raises other concerns. Second, the threat of closure or actual closure of these facilities means that a significant number of women in the Commonwealth don't have access to family planning services, and they may therefore be at increased risk of unintended pregnancies, and therefore the need for abortion may actually perversely increase rather than decrease.
Thank you very much.
I have one.
You have to shut down.
Shirley McKean, and then Dr. Wayne Smith.
Good morning. My name is Shirley McKean. I am the chair of the Virginia Coalition to Protect Women's Health. Right now, the state's 20 women's health care centers that provide first trimester abortion remain in limbo, waiting to either be inspected or to hear if VDH will grant them a license to remain open for the next 2 years. As you know, they have those 2 years to come into compliance with the forced building construction requirements of the emergency regulations. Unfortunately, this provision still remains in the new proposed permanent regulations, despite the advice of medical experts and thousands of Virginians asking that this part of the new requirements be stricken and that these medical practices be grandfathered in. These proposed regulations have nothing to do with patient care or safety. In fact, they will jeopardize women's health. These regulations force doctors' offices that provide first trimester abortion care and have been doing so for nearly 40 years, to now convert themselves basically overnight into hospitals, which you may agree is nearly impossible to do. They want you, as the Board of Health, to literally impose new 2010 hospital construction guidelines on existing doctors' offices that have been open and operating for decades for no justifiable reason. What this means is that women's health centers must spend hundreds of thousands, if not millions of dollars to add additional toilets and expand the size of their doors and hallways, increase treatment room sizes to the size of your car garage, making sure there are as many parking spaces as there are beds, and they don't even have overnight stays. And this is very expensive. In the end, this will lead to the closure of the majority of the 20 healthcare facilities that have applied for licensure with the Commonwealth of Virginia. I ask that you please reject these regulations. Thank you.
Thank you.
Dr. Wade Smith, and then Molly Dick.
Mr. Chairman, Commissioner, distinguished members of the board. I'm here to make 2 points. One is evidence-based medicine, which has already been made. Medicine I teach my students, and as a faculty member at VCU, recently retired for 38 years. What's the evidence for to proceed against it? As G. Watson James, the first hematologist in the state of Virginia, used to say, any test which is not indicated is contraindicated. The second point I want to make is about the Sovietization of medicine. Politicization of medicine. We have a history in this country. It isn't just the Soviet Union and psychiatry. And the complete disregard for scientific psychiatry and its use as a medical tool of oppression. We have the eugenics movement. We have racial medicine right in this state. We're on the slippery slope if you go down this path. Second, I want to talk about freedom of conscience. As a Quaker, this is, I think, the most valuable legacy Thomas Jefferson gave us. As a Quaker, I could have been hung before the Revolution. Don't marginalize an entire part of our population, greater than 50% of our women. Make no mistake, this is demeaning, and it is a war on women. What can you do as a board? If necessary, resign from your conscience.
Yeah.
And then Sarah Okalita.
Hi, my name is Molly Vick. I'm just out here as a citizen and mother, and someone who's very concerned about what's happening. I could speak on how first-trimester abortions are one of the safest procedures, how that's evidence-based, how this is very targeted and medically unnecessary, how they've never required the retrofitting prior and always the grandfathering, this new construction code. It's ridiculous and cost prohibitive, privacy issues, in terms of the files, the action, in terms of, but you know all of this. You know all of this because it's been said before. You know all of this because your own medical advisory panel said this. You know all this because they've been saying. You know all this because I know hundreds of at least citizens who have been writing to you and thousands who have signed petitions, which really begs the question, what's going on here? The permanent regulation process is supposed to be very transparent and iterative process. This has not been the case. The concerns of these medical experts and Virginia residents have been dismissed by the Donald administration's Department of Health. These proposed permanent regulations are just as bad as the emergency ones, actually probably worse. Now, someone up here earlier has mentioned several, separation of church and state. I will reference that our now Governor Bob McDonald's thesis includes the opinion that separation of church and state is conventional folklore. He doesn't believe it. You all have had an opportunity here. Your vote here counts. You all have a power to limit access similar to what the Supreme Court has in the nation. You know all the reasons not to do it, and I could explain to you many of the reasons why you would do it. Who's been appointed by whom, who's involved with what organization, who makes money to whom, who has stated that they can't separate their beliefs from their jobs. If you can't, you shouldn't be here. You shouldn't be in this vote. Please recuse yourself. If you can, please do. Look at the evidence and make sure that these regulations do not pass as they are.
Thank you. Sarah Okalita, and then Patty Connery.
Good morning, thank you for having me. I won't take up much time. I just want to remind you all that you still do have the capacity to amend these regulations. I ask you to do so, and I ask you to not allow yourself to be treated like a political pawn. This is about women's health. This is about strong and healthy families in Virginia.
Patty Connery, and then Mike Ratcliffe. Patty Connery here. No, is Mike? It looks like Mike.
My name is Isaac. I'm going to be very brief. I think you've heard a lot of good opinions from experts from the medical community today, and some women. I'm not going to speak to them. I'm here to remind you that these clinic regulations are completely medically unnecessary. They're entirely politically motivated. I know that some of you understand that very well. I don't know if all of you understand that and maybe wonder why. So I want to remind you that the GOP agenda since Roe v. Wade has not been to overturn it, but to make abortion as hard as it could possibly be. That's what's happening with these regulations. If you vote for them, you're complicit in that process and that agenda. We live in a democracy, not a theocracy. I don't think our governor, Cuccinelli, seems to understand that. And they seem comfortable forcing their worldview on the rest of our society. And I take great offense to that. I heard somebody talk about the unintended consequences of these architectural requirements. I will tell you that they're entirely intended consequences. Everyone should keep that in mind.
Susan Davenport and then Kathy Jones.
Susan Davenport, I'm a women's health practitioner at Planned Parenthood here in Richmond, and taking care of women who have had abortions day in and day out. I'm not a good public speaker, but was asked to say something today, so I felt compelled to do so. Just want to say that, this is never an easy decision for a woman to make, and you don't have to make it harder by limiting access to care. And really, we've been put in this position of power, and we need to take it seriously. And if you cannot vote without religious bias, then you need to abstain from the vote. Thank you.
Thank you.
Kathy.
Hi everyone, I'm Amy Allman. I am an artist. I have my Master of Fine Arts from Cornell University, and I'm also a respiratory therapist. I believe the trap laws, once again, are being used as a political device for political agendas. I just want to say that it's very important to keep clinics open, not just for abortion, but for prevention of disease. I've had 3 very close family members die of cancer. So I want to use the recent ultrasound regulation as a metaphor for the bigger picture. Basically, when I work in a hospital as a respiratory therapist, I work with critically ill people. Cancer, respiratory disease, COPD, hospitals are full of them. It's not that easy to schedule a simple exam, such as a sonogram, CAT scan, MRI. Not so easy. Sounds neat and clean on paper. It's not. Things get confused, people get mad at each other. It creates more stress in a medical environment. Basically, what these regulations are doing are stealing resources away from cancer patients, critically ill patients. Sounds good on paper. You see a lot of harm in the hospital and in personal lives. And you're going to see it. As you close down these clinics, you're going to see people you love suffer. Really. I thank you for your time, and this is a new process for me. I like getting involved in politics, and I really hope even the GOP, you can still amend these laws and help sick people, help the terminally ill, keep clinics open. Thank you.
And I apologize, that was Amy Altman, so Marianne Hughes and Amy Daniels.
Ladies and gentlemen, thank you for the opportunity to speak, and especially thank you for the hard work that you do on behalf of the citizens of Virginia. I am a retired clinical psychologist from Hanover County, and I support what my new friends here have told you so far, and I don't want to bore you by repeating their good points. So I want you to imagine something. I want you to imagine that the legislature of the state of Virginia just yesterday passed a bill that says that any citizen must pass a college-level exam in American and world history in order to possess a handgun. Can you imagine, can you just begin to imagine the outcry that would go up if that kind of law were passed? The first argument we would hear is passing an exam in history has nothing to do with gun safety. And they would be right, of course it doesn't. Passing these regulations has nothing to do with women's health safety. The analogy is clear and strong, and I encourage you to think about the slippery slope that others have imagined, because if your ideology can be used to pass this regulation, think how others might be using their ideology in the future. Don't set that precedent. Please don't go there. If these regulations pass, poor women in Virginia will lose access to health care, and some of them will die. Virginia should hang its head in shame if that happens.
Thank you very much.
Hi. Amy Daniels and then Emily Crouching. Same person wrote about 20 years. So
Okay.
they may not know how to spell it.
So I'm a therapist with families and children who receive Medicaid, particularly kids with serious emotional and behavioral disorders. I work in their homes, I work in their schools. Most of my clients have asthma. A lot of my clients are diagnosed with ADHD. Most of them are on all kinds of intense psychiatric medications. But they're also all on food stamps, which is very low, and they can only afford to eat products that have tons of high fructose corn syrup in it, which doesn't do anything for their ADHD. You might be wondering why I'm talking about that, but what I wanted to say is, what about life after birth? Isn't that what you all are here to actually take care of? Can we focus on that? Can we spend some money on that? My kids are starving, basically. Okay? They're being medicated for behavioral problems when they actually can't even access proper diet. Their families have poor prenatal care. I mean, this is what we really actually need to be focusing on. So let's not waste our time, let's not waste our money. Let's focus on life after birth. Thank you.
Emily Crouching and then Daryl Brown. And it's not Crouching, there is no Crouching. But we've got you on page 2, page 3, and page 4. So I apologize to everybody, but again, because people didn't write their own names down. Okay, somebody wrote down.
My name is Emily Trudling, and I'm a health educator at Falls Church Healthcare Center, one of the facilities threatened by these laws. I am also a native Virginian, daughter, girlfriend, a granddaughter, and a best friend. I am not, however, a second-class citizen as these proposed permanent regulations define me. I have the honor of working with women exercising their right to control their lives. These women are the reason I'm standing here before you today. Their voices and strength inspire me, and I hope they inspire you. The voices of the patients I love have not been heard by this board, but they are heard in our center. We not only provide excellent and affordable medical care, but we also provide a safe haven for women and their families amid domestic violence, sexual assault, employment discrimination, harassment, and the myriad challenges women face in our society simply because we are women. Our center cares for women, and in turn, we nurture their families and neighborhoods. It is a common misconception that if pro-choice healthcare centers close, abortions will cease to exist. This board cannot stop women from having abortions. Women will always have abortions. They have for thousands of years and will continue to do so in Virginia despite these arduous and unnecessary restrictions on pro-choice healthcare clinics. Women will resort to any means necessary to exercise their innate right and responsibility to control their lives. I have spoken to women who have gone through efforts to self-abort. These stories of desperation will become commonplace if our centers close. This board has the responsibility to work with healthcare centers to grant women access to safe and affordable reproductive health care. It is your charge to decide whether or not women must choose abortion methods that threaten their lives or save them. Remember, women's health care transcends politics and is about the safety of the people at the core of our neighborhoods, Virginian women. We are not second-class citizens who can have our lives bargained away to push a political agenda. Our voices will be heard.
Thank you very much.
Leslie Rubio.
Thank you. I'm Darrell Brown. I'm a feminist, I'm an activist, and I'm a humanist. Forgive me, I've gone about 24 hours without sleep to be here. I'll try to be short, but I can't promise to be sweet. I'd like to address 3 of the things that the state board, or the Board of Health, is supposed to protect and provide the citizens of Virginia. Reduction of disparities in health care and health status. If our abortion clinics close, poor women will be affected. They'll be the ones who can't afford or reach safe abortion. Improvement in the health and well-being of all Virginians. If our abortion clinics close, people will try to self-abort, as the speaker just prior to me stated that she's already dealt with people like that. People will die, people will harm themselves, and the health and well-being of Virginians will be thrown under the bus. Supporting improved access to preventive and primary care services. Well, I think we can all see where this is going. I am far from an abortion apologist, but I can access the internet. There are decades of information on file with the United Nations and with the Guttmacher Institute that show worldwide, since we're not the only people who deal with abortion issues, the only way to reduce abortion is to provide access to contraceptive care and contraceptive education. If you take abortion away, you get the same amount of abortion. You get the same amount of illegal abortion. Prior to Roe versus Wade, botched abortions, back alley abortions accounted for 40% of maternal deaths. If we reduce abortion access here, we will see that again.
Thank you.
Leslie Rubio and then Marilyn Austin.
I have two questions. I have two questions. Why were the recommendations changed that were given by the doctors to the board? Why were they changed and re-presented to you in a different way? I also want to ask a question of all of you. Are there any rules or regulations for your members with regard to being politically involved with a campaign, fundraiser, sponsorship, or anything to do with campaign fundraising? Can you answer that question?
Are you finished?
I'm asking you that question.
Well, during public comment, that's what public comment is for. We don't respond to questions.
I would like to state then, if there is a rule regarding that members of the board are not allowed to sponsor, campaign, or hold any fundraiser for any political candidate, that Ms. Gail Taylor should recuse herself from that, as yesterday she was part of a group of people who held a fundraiser for Mr. Kushner.
Thank you.
Marilyn Rothstein, and then
Hello, my name is Gina Barber, and I'm a student at the University of Virginia. As a student at UVA, I'm practically required to quote Thomas Jefferson at every available opportunity. So I will do so now. Thomas Jefferson once said, "The majority, oppressing an individual, is guilty of a crime, abuses its strength, and by acting on the law of the strongest, breaks up the foundations of society." In Virginia, women have we have rights to access the necessary health care at these women's health clinics. Any attempt to prevent women from accessing these services, according to Thomas Jefferson, is a crime. While these regulations may be intended to protect Virginia citizens, they will in effect prevent us from our freedoms. Don't let your politics blind you to the real health needs of men and women in Virginia. Please reject these tragedies. Thank you very much.
Good morning. My name is Colleen Osborne. I, as a woman, and especially and particularly as a student, these regulations directly affect me and other young women like me. We are the future with which these regulations will affect the most. These regulations put a financial burden on all clinics, inevitably leading them to close. If you close more clinics, you close the opportunity for women, especially young women, to get the crucial health care that we need. When they close, where will I go for my health care? Where will my friends go for their health care? We cannot go backward. Can I ask the younger people who support my words to stand up? We are the future. I should not be standing here before you today to ask you for the rights of my body, but since I am, I need you. These women need you to reject these regulations. Thank you.
Deborah Miller and then Gabrielle Schatz.
Hi, I'm Deborah Miller. I'm a native of Virginia and I'm 20 years old. The reason why I say that I'm 20 years old is because many would say that it is my age group that is the future of this nation. And because of that, I would also like to mention that it is also my age group that would be the most affected by these women's health clinic regulations. If I am supposed to be the future of this nation, then what will happen if my health care is restricted? What will happen to the future of this nation if women aren't even able to receive the health care that they need? What will happen? And I think as a student, as a native of the Commonwealth of Virginia, and as a woman, I really urge you to please reconsider these regulations.
Gabrielle Schatz, and then Roland Winston will be next up.
Hi, this is my first time speaking here, and first of all, I'd like to applaud you all for the way you do it by calling two people's names at once. It's better than how Richmond City Council does it. I'd also like to point out that everyone here has talked on the same side of this issue, so I think that's something to take into consideration. If I were ever in a difficult position of having to make such a choice regarding abortion, it would be very, very tough. But I would want to have that choice. And I'd like to repeat, it would be a very difficult decision, as I suspect it would be very difficult for everyone here. But without that choice, what do we have? Thank you.
So I apologize. We have Roland Winston, and then Evangeline Jones.
My name is Roland Winston. I speak today on behalf of Virginia Youth Majority. The organization is a grassroots social justice organization with chapters in Northern and Central Virginia and the entire Wood area. We oppose the regulations that you are considering. The original proposal for paid life positions. I'm obviously willing to help work on this. Our organization and I personally am very involved in efforts with the Social Services Department in regard to the adoption regulations. And following that vote, I spoke to two of the board members. And one woman, when I asked her about her vote, said she had to vote her Christian values, said it pretty snippily and turned on a heel and walked away. The second one said that the board was not the place for us to be attempting to make a political statement. I'll say to you today what you've heard about, in particular a couple of actual board members, issues before you and how this was brought forward through the General Assembly. It's a political issue from that angle. These women and the people that they represent, all of us and the people that they represent, are not here for political gain.
Evangeline Jones, and the next will be Stephanie Sabedla.
Good morning. I'm Evangeline Jones from the Americans United for Life, and we appreciate this opportunity to speak in support of Virginia's proposed abortion clinic regulations. Enacting comprehensive abortion clinic regulations is critical for protecting women's health and safety, and has proven to be a sensible solution to the growing problem of unsafe abortions. Currently, more than half of the states maintain specific regulations on clinics and facilities performing abortions. Many reasons support the need for these regulations, and I will highlight three. First, contrary to public claims, abortion providers do not foster or maintain a patient-physician relationship with women. A significant percentage of all abortions are performed in clinics devoted solely to providing abortions and family planning services. Most women who seek abortions at these facilities do not have any relationship with the physicians who perform the abortions before or after the procedure. Thus, in the absence of a traditional and ongoing physician-patient relationship, it is important for the state to act to ensure proper patient care. Second, abortion is an invasive surgical procedure that can lead to numerous and serious medical complications. Potential complications include, among others, hemorrhage, infection, uterine perforation, blood clots, cervical tears, incomplete abortion, missed ectopic pregnancies, cardiac arrest, respiratory arrest, reactions to anesthesia, and even death. The risks for second trimester abortions are greater than for first trimester abortions. As abortion provider Warren Hearn, the author of leading abortion textbook, writes, there are few surgical procedures given to so little attention and so underrated in its potential hazards.
I'm here speaking to you today as the daughter of an employee of the Virginia Health Department. My mother has been employed as an interpreter since 1997, and she has served the Virginia community in Henrico, providing family planning resources for a community that's really in need. So I grew up watching my mother provide highly needed access to things that really serve women in the community and community in general. I grew up thinking that that's just how it was. When people are in need, there's a way to provide for them. There's a way to give them access to the resources so they can live their life and plan their family as they choose. In 2007, I ended up on the other side of that situation. In 2007, I had an abortion at Planned Parenthood in Richmond. The clinic was 12 blocks from my house, and it was extremely easy for me to call them and make an appointment. Everyone was friendly, efficient, and made that extremely difficult experience as easy as possible for me. As I left, I started to get extremely emotional. But when the nurse practitioner asked me if I was in pain, I said no. I was extremely grateful. And I knew how lucky I was to be able to walk so close to my home and get access to this thing that I truly needed. I was relieved, and I was just filled with gratitude to these people who provided this for me. Please do not make regulations that keep other women from having access to this. We need this, and do not prevent us from deserving what we need as human beings. Thank you.
I'd like to first thank the board for providing us opportunity to comment on the important regulations which we draft to improve abortion clinic safety. Mr. Chairman and Virginia, members of the Virginia Board of Health, my name is Julia Hewitt from the Family Research Council in Washington, D.C. We are a public policy organization that defends human life and religious freedom and represents thousands of people around the country, including individuals from the state of Virginia. FRC adamantly supports stronger regulations of abortion clinics in Virginia. Abortion remains one of the least regulated surgical procedures in the United States, often resulting in unsanitary and unsafe conditions. We have seen real-life examples of this in the past year, most notably in Pennsylvania, where women have actually died from unsanitary abortions. The evidence of unsafe conditions that exist in abortion clinics demonstrates the pressing need for the Commonwealth to enact strong clinic regulations. Among other things, the new regulations call for improved sanitary conditions and the presence of emergency equipment in cases of cardiac arrest, seizure, respiratory distress, or other symptoms. They also include common sense requirements, such as requiring a doctor to stay on the premises until the patient is discharged. The proposed regulations under consideration today seek only to have abortion clinics conform to the same safety requirements that are met by other similarly situated healthcare facilities.
This is eminently reasonable and completely constitutional. True concern for the life and health of women lies on the side of greater regulation for abortion clinics, which the courts have historically supported. Since Roe v. Wade, the United States Supreme Court has recognized that the state has, quote, a legitimate interest in seeing to it that abortion, like any other medical procedure, is performed under circumstances that ensure maximum safety for the patient. It is the position of the Family Research Council that the proposed Virginia regulations are necessary to ensure maximum safety for women at abortion facilities. We strongly support Governor McCarthy.
Please.
Chris Freund, and then Megan Fadley will be next up.
Commissioner, members of the board, Chris Friend of the Family Foundation, and I'm here representing thousands of Virginians and Virginia families who could not to adopt the proposed permanent abortion center regulations. In just the past 18 months, news stories of doctors and abortion center owners in Virginia have exposed a pattern of failure to adhere to even the most basic health concerns. One doctor, Stephen Brigham, became notorious for putting the health of women at risk at his abortion centers, and at one point was under indictment for murder in Maryland. Charges were dropped because officials there could not determine where the deceased children found in his clinic had been killed. Brigham, who has no license to practice medicine in the Commonwealth of Virginia, owns 2 abortion facilities, and at one time advertised that he would begin late-term abortions in his Virginia facilities, and then ask the patients to drive themselves to facilities in other states. Recently, a patient at Fairfax's Noble Women's Healthcare was rushed to the hospital due to complications after an abortion. The director of that facility.
My name is Megan Baslin, and I'm a college student here in Virginia. You have heard in testimony by abortion industry representatives and defenders that the basic health and safety standards you are considering today will force many abortion centers to stop providing other services they currently provide. But that is what logic calls a false choice. There is nothing that keeps these entities from providing other services.
Safety standards for the women of this great Commonwealth. Thank you, and VSHL urges you to support the new basic and safety standards for Virginia abortion centers and make the regulations permanent. Thank you for your consideration.
Stephanie Arnold, and then Marie.
Based medicine, but we've done that. So instead, I just want to remind you of one thing, and that's that anti-choice women get abortions too. I know that because I've worked for a local abortion provider for the past 4 years of my life. And these women have no problem supporting TRAP. They have no problem voting for anti-choice legislation because, let's be honest, they can afford to get their abortion anyway. Right now, I'm looking at 15 women in front of me. Chances are 5 of you have had an abortion, statistically speaking. If we include the men and think about your family members, your wives, your daughters, your mothers, your aunts, someone in there has had an abortion, and she's had a safe abortion because she could get access to it. What you're doing today is threatening to throw all of that away. You are putting women's lives at risk, and you know it, whether you want to admit it or not. I know it's hard for me to say anything that will change your mind today. I'm a lowly, naive medical student, clinging to the idea that truth and ethics still mean something. But I do want to let you know that I'm embarrassed. I'm embarrassed as a physician in training. I'm embarrassed as a citizen of Virginia, but it doesn't have to be that way. You can still save us from becoming a stain on the fabric of democracy. Listen to the expert advice that was given here today. Listen to the outraged voices of the women of the Commonwealth and reject these regulations. Do the right thing.
Before you to express my opposition for the regulations before you, as I do not believe they are designed to protect women's health, as has been stated by many. Rather, I believe they are politically driven and medically unnecessary. In anticipating coming here today, I had a lot of thoughts, many of which you've already heard, so I'm going to abandon those and talk to you about what was in my mind when I anticipated coming here. And that was the fact that I'm familiar with this building because I hold a license with VDHP. And I know that VDHP's mission is to ensure safe and competent patient care by licensing health professionals, enforcing standards of practice, and providing information of healthcare to practitioners and to the public. I'm quite familiar with this location, as I said before, because I'm a licensed clinical social worker. And I have a license, as do many of you all here on the board. I value my license, and I have a professional code of ethics that I adhere to every single day in working with my clients. It is the backbone of my practice, it is what drives me, and it is what shapes my decisions as I make them professionally. In coming today, I looked at the AMA's medical ethics, which I'm not familiar with. I'm familiar with my own social work code of ethics. And several things stood out to me about the ethics that you all are bound to. In particular, items with regard to honest professional interactions, striving to report other physicians deficient in character or competence, engaging in fraud or deception. Other items mentioned, recognize responsibility to seek change in those requirements which are contrary to the best interest of the patient, make relevant information to patients, colleagues, and the public known, and caring for the responsibility of patients paramount. Also, number 9, a physician shall support access to medical care of all people, access to medical care.
Thank you very much. Appreciate it.
Annie Olive and then Alice Cohan.
Thank you. I'm Eddie Ayler. I'm with the Virginia Assembly of Independent Baptist Executive Director, representing at least 500 churches throughout the state.
I'm Alice Cohan, and I'm with the Feminist Majority Foundation. We're based in Northern Virginia. And I wanted to go back for a minute to the great report that Commissioner Renley started the morning with on showing the decreasing numbers of teen pregnancy in this state. And I want us to think about why that's happening. And that realistically, we have to share some of the credit of that to the clinics that are represented in this room. That to a large extent, not only do these women health care clinics provide abortions, but they also provide a wide range of services to women that include reproductive rights issues, that include the education and the disbursement of birth control and contraception education. So that if in fact these regulations go forward as they stand, and we lose a number of these clinics, we must recognize that the consequences of that is that we will have young women especially lose access to birth control and to remedies to keep teen pregnancy low. What happens to the young woman then who was raped? What happens to the young woman who has serious complications, who wants to bring this pregnancy to term, but for health reasons cannot do that? What happens to the young woman who is pregnant because of the result of incest from a family member? And I hope you'll consider all of this.
Thank you very much.
I don't think it's here, so Rita Bell.
Actually, it's Will Fitzhugh. I'm actually not a doctor, I'm just a very lawyer.
I apologize. So it'll be Will Fitzhugh and then Sharita Field for Senator Bola.
Will Fitzhugh, lowly lawyer, although not a doctor, although apparently that means you should listen to me more than my dad's doctor, based on past history. I enjoy listening to this Board of Health hearing. I enjoy listening to Dr. Renley talk about problems identified by the board and addressed by the board. That's why you all volunteer your time here. Abortion in Virginia is already safe. Like every other similar medical procedure, like LASIK, liposuction, colonoscopy, the Board of Medicine ensures safety. A safe medical practice. They already do that. Mr. Evans failed to mention that the Virginia Code section states that you have to adopt, promulgate, and enforce regulations. The law enacted by the General Assembly simply says to classify them as hospital. It doesn't tell you what they should say, contrary to your trained journalist belief. What has happened in every prior example, every time the board has adopted regulations, every time before this, the design and construction, you exempted prior existing buildings every single other time. That hasn't happened here. It's a sad day in Virginia when you make this body a body to be lobbied. It's a sad day in Virginia when the Board of Health advocates its health goal, it's an evidence-based health goal, and it follows political dictates of the people that appoint you. It's a sad day in Virginia. We have to vet the political backgrounds of the Board of Health, just like Supreme Court members in a nomination process. That's a sad day in Virginia, and I hope you're ready for that.
Thank you.
Unfortunately, which is asking you to read this prepared statement. For those of you on the board or with the press, I'll have extra copies for you for almost 4 decades, Virginia's women's health centers have provided safe, accessible, and comprehensive reproductive health care. The costs associated with meeting the requirements of proposed permanent abortion clinic regulations would be so prohibitive that clinics could be forced to close. These closures would be devastating to the health of women and families. Virginia's women and families need low-cost, comprehensive reproductive health care offered by the health centers that these track regulations are intended to curtail. If the State Board of Health makes these regulations permanent, women in many parts of the state will be denied access to basic primary and preventative care. Women will also be denied access to safe and affordable abortions, forcing many to seek back alley procedures that physically harm them for a lifetime. As responsible decision makers and advocates for good health, we should want women to have access to cervical cancer screenings, breast cancer screenings, pap smears, sexually transmitted infection testing and treatment. Moreover, women of Virginia need access to incest, rape, and sexual abuse counseling and referrals. Again, if we care about the improved health outcomes, then women need access to birth control counseling and access to emergency contraception and pregnancy testing. Let us not forget that women and their unborn children need comprehensive prenatal care, and these clinics also provide that service. Moms who do not have access to prenatal care are much more likely to deliver low birth weight babies, babies born with addictions, and babies born with learning disabilities. We all pay the price when the next generation is not given a healthy start to life. I ask you to consider the impact of your decision on the health of women throughout the Commonwealth. The Board of Health should act in the best interest of Virginians and not be motivated by a political ideology and the desire by some to control the Board of Health decisions and health choices of women. Thank you so very much.
Could you give us a copy of that so we can read standards?
To protect women's health. It is from this perspective that the Virginia Catholic Conference has long that are currently in place and that have been proposed reasonable common sense measures to ensure, for example, that abortion centers have life-saving equipment on hand, that they abide clearly defined building guidelines, that they have written policies regarding infection prevention, fire safety, and use of ultrasounds, that they report patient deaths resulting from abortion procedures, and that they have physicians on site until patients are ready to be discharged. These reasons we ask for a favorable report. Thank you.
Thank you.
Federation. NAP is the Professional Association of Abortion Providers in North America, and our members include women's health centers in Virginia, many of whom are here today. For more than 35 years, NAP has ensured the safety and high quality of abortion practice with standards of care, protocols, accredited continuing medical education, and our evidence-based clinical policy guidelines which set the standard for quality abortion care in North America. Abortion care is one of the safest and most commonly provided medical procedures in the United States. Fewer than 0.3% of abortion patients experience a complication that requires hospitalization. Credit for this outstanding safety record goes to the women in this room and the abortion care that they provide at outpatient facilities. We are very concerned that these regulations as drafted could jeopardize the ability of women's health centers in Virginia to continue to provide this safe, quality abortion care and limit the ability of the Virginia women in this room to access that care. One of our primary concerns, as people have spoken about already, is protecting the safety of our providers and their patients through maintaining the confidentiality of sensitive information. Confidentiality of patient information is of paramount importance to women's health centers in Virginia and the medical community as a whole. Abortion providers, their staff, and their patients are targeted for harassment by protesters outside of women's health centers, as well as other anti-choice extremists and individuals. In the last 2 years, there have been more than 150 individual incidents at our facilities in Virginia, including picketing, harassing mail and phone calls, and suspicious packages left on the premises. Videos of patients and clinic employees have been posted on the internet. Violence and harassment is prevalent throughout Virginia. It's vitally important for the safety of patients and for abortion providers that the confidentiality provisions and provider protections in these regulations be strengthened. Any information that's shared with a department representative in the course of licensure must be kept confidential and not be available to the public.
Sensitive information about patients and staff, ownership, policies should be kept confidential. Thank you so much.
Thank you very much.
Gladys Tatarsky, and then Jordan Romeo.
My name is Gladys Tatarsky. I am a retired senior citizen, and I don't have a long list of credentials, and I really don't expect to repeat things that I've heard today. I base my information on the article that was in this Tuesday's Times Dispatch by the, I believe the lady is here today, Associate Professor at the University of Richmond, Meredith Johnson Harbeck. It's this article that brought me here today. I am against the trap regulations. I believe to have these regulations enforced would be detrimental. They would be actually draconian, and they will make Virginia go backwards instead of forward. And those of us who have been living in Virginia all our lives know that Virginians have a hard time going forward. So I respectfully ask you to not let this regulation be put in place. Thank you.
I'm going to butcher this name, I apologize. I think it's Ann Kabat or Kavar. If any of you maybe decided to get Gordon. And if not, there's Callie Emerson. It's the last person who signed up.
My name is Jordan. I work for a local abortion provider. I was about to relay, I was waiting on a message from Gloria Steinem to relay off to you all. She unfortunately didn't finish it in time. You can see it later today on facebook.com/opposedtrap. You may want to see that, and if you don't know who she is, you should probably learn. I also want to mention that the clinic inspections at the abortion clinic that I work at, the people who reviewed all the necessary aspects of these recommendations, they said that the recommendations were overwhelmingly architectural. So again, not really helping to save women or help women. This isn't a health thing, it's a political thing, we all know that. So again, we ask, as several dozens and dozens of people have asked you all to rethink this decision and please oppose these draft regulations.
Hi everyone, my name is Jason Moore. I'm only 18 years old, but yes, I do have a little bit of brains. Back in history, the women particularly, fought the longest to get their rights. And with this meeting right here, y'all are giving it up. Y'all are giving up your choice and your right to do whatever. Okay? Now, if I could from the audience, can I have all the grandmas stand up? Now, I want you all to look at them right now. Either one of them could be y'all's mother. They made the choice to keep y'all here. Okay? When I was born, the doctor told my mom that she should have an abortion because my brain was messed up and I would live a painful life. Look at me now. I'm up here speaking for her because she couldn't make it. I'm speaking for my sisters. I'm speaking for the women who helped raise me throughout my life to get me to this point. And I hope that the women sitting here, how many, 15, 14, y'all are giving up y'all's rights too. You're giving it to the government. You're saying, no, I don't want to have my own voice heard. I don't want to have, can't figure out the word right now. But anyways. But you're giving it up, and it's a shame, and you need to vote against this. Thank you.